I will start by saying coronavirus is a new virus. It's a very serious virus. As of yesterday, it had infected more than 200,000 people and killed over 8,000 people. And we haven't got a case here in Zimbabwe from official sources, but our neighbors in South Africa have reported cases. And due to our proximity to the South African country, we are likely going to have some corona cases in the coming weeks. So the background of this coronavirus, for example, if we take the 1918 flu outbreak, it was called the Spanish flu, which killed 33 million people. So we are fearful that if this arrives here, it could kill a lot of people. And this virus basically will be moving from person to person. So what is left, since the virus is likely going to be here very soon, is how the public gets protected. The virus itself is a member of the common flu, so it's transmitted via coughing and droplets. So, and it takes up to 14 days to show. And the virus also, you can get it by touching surfaces where someone has coughed and left some particles of the virus. And this virus also can infect you via the nose, via the eyes, and via the mouth. So basically, if you walked in a room full of virus in the air, you will get infected. So this is going to be serious. People start there are some people after a few days or 10 days to 14 days start showing symptoms. Symptoms will be flu-like symptoms. And you may start coughing, and you may start having shortness of breath. And what kills people is serious respiratory distress, where you are unable to breathe and you die. So countries in Europe have tried even to put people on ventilators, but they are still reporting very high numbers of deaths, despite their treatment and wearing protective clothing. One of the questions that I keep being asked by people, how prepared you are, how prepared. No one has been prepared for this virus. It's a new virus, and no country, including the developed countries, are prepared for it. Even in America, they are reporting cases. So it's a virus that will come to you whether you are prepared or not. The basic thing is that we should prevent the virus from spiraling out of control. The few countries in Europe have made mistakes by mixing people who are infected with the virus and bringing them to normal hospitals. And that has caused widespread infections in the populations and continuing deaths, if you look at the figures coming from Europe. So in Zimbabwe, we are lucky right now, we haven't got a confirmed case. So we should educate the public that Mpilo hospital, for example, is not an infectious disease hospital. This is a highly infective disease. So people should ordinarily not come to Mpilo with this virus, because they will infect everyone and we will not be able to control it. In Solwayo here we have Thorngrove Infectious Disease Hospital run by the City Health Department. So our idea, we should educate people. The best thing is not to get this virus into your body, because it's a new virus and we don't know once inside your body what is going to happen to you. You may not recover despite all the treatments you get. So prevention is better than cure. And we first start by educating the public that if anybody has had any history of travel, or they've been in contact with someone with the coronavirus, or they may feel that they are having coronavirus because they are having a fever, they are having flu-like symptoms, they are having difficulty in breathing, they are coughing. Ideally, those people should go to Thorngrove, where they are going to be screened they will be tested, and the people at the city health will decide whether to put them at home for self-quarantine or they put them in hospital. That is important so that the disease doesn't spread. Because if it's spreading, that's when it becomes very dangerous. And then it starts killing people. So ambulances, they should, any hospital like Mpilo, anybody suspected of coronavirus should be immediately removed and sent to an infectious disease hospital. And there the people will take care, who are trained in infection disease control with the equipment and the clothing. On a personal note, we strongly advise people not to travel unnecessarily, especially if you don't have any business. You just have this idea of just getting into a bus and wandering around the central business. If you have no business, you should sit at home, even for days, so that you don't go into crowded places. You are forced yourself in combis, in buses, wherever. You may find the virus in your hand and you inoculate yourself. So we don't want unnecessary travel, both inside the country and outside, moving unnecessarily for no reason. So travel should only be for essential purposes. A doctor, a nurse, a journalist, where you work, policeman, a soldier, where you cannot avoid traveling. Those people who are going for employment, those who don't have anything, we say we stay at home. So you are protecting yourself from actually going to get the virus. And we advise people, especially now with our community here, with the strong links to South Africa and things coming over the border with Omalaicha, what. We advise them to stay where they are, and we stay over here until this disease is gone. Because people can actually bring it over with Malaicha here overnight. It's only an overnight trip, and it will spread out in the locations. So we avoid that kind of travel. And then it boils down to personal hygiene. So we advise that you cancel parties, we cancel weddings, you don't go to crowded beer halls and so forth. And you take care of your own personal isolation so that the virus does not get to you. Because once the virus gets into you, we don't know the outcomes. If people in Europe are dying in such numbers, you can imagine us here. And then, now whenever you touch surfaces, we want people to wash their hands, because one of the critical bits of transmitting the disease, unlike the common cold that we are aware, common cold doesn't get transmitted by hands. This one is a different virus. We need to have personal hygiene, washing our hands regularly. Like now, after you touch, you go and wash your hands over there. That is now on a personal level. And now the government has done very well. It's going to close down the school from next week. So it means schools and universities, people stay at home. And I'm sure the government has even a bigger plan. If there is a confirmed case of a coronavirus, there will be another plan that will kick in to make sure that we contain the virus. So the other group that we have to discuss, the people that are at high risk. Children seem to get the virus and they don't seem to die from it. But people who are above 60s, 70s, they are the ones who are getting, who are dying. So the next group of people are people who have got other diseases, like you are hypertensive, you are diabetic, you are taking antiretrovirals, you have got TB, you have got cancer. Those are a very high risk group of people. So when we say self-quarantine, we know that most of the people who get better, especially children, if you can stay in that family home and not move around unnecessarily, even if you were to get sick, the government will be able to control the virus in one single household. What we don't want is mass inoculation of the population. You rather have one Ngwenya dying with the virus and buried, rather than Ngwenya infecting hundreds and hundreds of people. Get my point? So self-quarantine is, city council is already doing it. They are having people that they are monitoring from home. You sit at home, and if you get sick There will be a rapid response team from the city health, which is going to come and collect you from home and take you to Thorngrove. The critical bit as Zimbabweans is that once this virus comes, first we should make sure it doesn't come. We tell people not to unnecessarily travel over the border, bringing goods, relatives. You may actually be delivering coronavirus for us because we said it can stay for 14 days. You have no symptoms, but you are passing it on. So you are delivering things by malite. You are also delivering virus and killing families. So we should make sure we don't get it. And if we get it, we will be able to control it by making sure it does not move from one person to the other or from one family to the other. This is not time for mass church gatherings, mass weddings, otherwise we will not win. Currently, what you should know is that this is a virus. Virus is medical. We have failed to have a cure for them. We have supportive care. So at home, people seem to, when you get the virus, you are likely going to recover on your own. That's why I said your body is going to fight the virus. It's either you win or the virus is going to win. So people take supportive measures like taking vitamin C's and eating fruits and veggies just to get healthy. Because what is going to determine the struggle between you and the virus is who is stronger. So that's why my talk is that try by all means possible not to get this virus into your body. Prevention is critical. Make sure you do not go to places where you are going to get virus into your side. Because once you get virus into your body, we don't know what is going to happen. There are some myths. The other myth that I heard is that black people don't get the virus. It's a myth. Everyone is getting it, and you will die from it. And two, viruses, I wish we had. I already told you in 1918, 33 million people died. And this Mlota thing is not going to. It's a myth. I will not advise you to take it. It's unscientific, and it's probably not going to do any good. And another to say what I am saying, and I put out a tweet. If people do not listen to what I am saying, both the people, the government, the city council, and the virus does indeed come to us, we may see mass deaths, and that is going to attack people with asthma, diabetes, heart diseases, HIV, cancer, what. We see mass deaths. So that's why I'm emphasizing that please travel only when it's necessary. Stay at home, put your own self-quarantine, not to get the virus. Keep personal hygiene. Don't let anyone cough or sneeze on you, because once the virus lands on your eyes from coughing, make sure no one coughs or sneezes at you, so you keep some distance between you and your colleagues. Right now, we urge that anyone who is suspected or, like I said, with it, traveling, a strong history of traveling or coming in contact with someone whom they may think, or they have got symptoms that I say, the fever, coughing, chest pains, what. The best place to call, there's a rapid response team with the city council. You can find the city council, phone them. There's a specialized ambulance that will come and collect you. That will help because you will not go to the doctor's surgeries, you will not go to the local clinic, you will not come to the central hospital. Because once you come here, you are actually endangering a lot of lives. So the rapid response team from the city council will take you to Thorngrove. They will check you. If you need to go back home for self-quarantine, they will take you back, and they will come and check on you on a daily basis. Yeah, so the message is that you should not rush to see your usual health practitioner because you may be endangering them. You phone the city health department. They are the ones with the capacity to handle the infectious disease.